Hi, Kristen. How are you doing?
I'm good.
I'm going to close your door for some privacy before I do your assessment. I'm going to sanitize my hand. While I'm sanitizing my hand, I'm also surveying your surrounding. Make sure it's safe. There's no wires that's going to trip you. And then, Kristen, my name is Chris. I'll be doing your health assessment today before you see the provider. First thing I'm going to do is just go ahead and give me your name and date of birth.
Kristen Brown, 12/14/1982.
Thank you. So this health assessment is probably going to take about 20 to 30 minutes, if that's okay with you. We're going to do some exams, to assess your neurological. We're going to do some neurological assessment, and then we're also going to do some musculoskeletal assessment today. And as I do the assessment, I'll go ahead and explain as I go.
Okay.
And I'll also inspect your skin as I go through the assessment as well. Okay. And then the first thing I'm going to do, Kristen, do you know where you are?
Yes, I'm at the clinic.
Do you know what you're coming in for?
Yes, I do. I'm having ear pain.
Okay. And then do you know what day it is?
It's Friday.
Okay. Do you know the time and date?
It's sometime Friday afternoon.
Okay, perfect. And then, so you mentioned that you're coming in for ear pain.
Yes.
And then, when did it start?
2 days ago.
Okay. And then is it both ears, right or left?
It's just the right ear.
Okay. And then, as far as pain, from 0 being none and 10 being the worst, are you able to rate your pain?
It's about a 5.
Okay. And then, as far as your symptoms, can you go ahead and describe your symptoms?
It's just this deep, continuous ache in my right ear.
Okay. And then, did it gradually, the pain, did it gradually started, or was it just a sudden onset?
It started kind of gradually 2 days ago, but I definitely have noticed over the last 2 days that it's gotten worse.
Okay. And then, is there anything that makes it better or worse, or is there any time of day you feel like it's better, or is it worse?
Well, it's definitely worse. I would have to say it's definitely worse mornings and evenings. And then as for making it better, I'm not taking anything over the counter, but I have found like a nice warm compress right on the ear has helped alleviate some of the symptoms.
Okay. And then as far as other associated symptoms, are you having any sore throat?
No sore throat.
Okay. Any, do you wake up in the morning where you feel like you have a lot of postnasal drip?
No.
Okay. Any symptoms of fever, nausea, vomiting, diarrhea?
No, none of those.
Okay. And then have you had any of this problem in the past? Do you have any history of ear infection, sinus infection, or any type of like upper respiratory symptoms?
My mom said when I was a child, I got ear infections a lot. And then I've had strep a couple times as a child, but not this issue as an adult. No.
Okay. And then you still have your tonsils?
I still have my tonsils.
All right. And then as far as allergies, do you have any allergies on medications?
I have no known allergies for medications.
Any environmental allergies?
No.
Allergies to food or latex?
No.
Okay. And then as far as any type of surgeries or hospitalizations, can you recall any surgeries or any type of hospitalization that can relate to your visit today?
The only surgery I've had was I've had my wisdom teeth taken out when I was 20, and hospitalizations for this, no.
Okay. And then as far as family history, is there any history of cancer, any type of throat cancer in your family, or any type of like ear infection that's recurring in your family?
No cancer, no reoccurring ear infection. I think actually everyone in our family has the tonsils. My dad has a long history of allergies though.
Okay, and then you, since your ear can affect your balance, are you having any type of dizziness or lightheadedness at all when you stand up or when you change position from standing to sitting?
No.
Have you noticed any changes on that, postural changes?
No.
Lightheadedness, okay. And then we're gonna go ahead and move on to your psychosocial history. We asked all of the patients about psychosocial history. Are you a smoker?
No.
That includes e-cigarettes and any type of smokeless tobacco?
No.
any alcohol?
No,
Okay, how about any illicit drugs or marijuana use?
not at all.
And then, as far as safety, do you feel safe on your environment?
Yes.
Do you feel safe at home, in your relationship, in your surrounding areas where you live?
Yes.
Okay. And then, Kristen, I think this concludes the general survey.
Do you need to know what kind of medications I'm taking?
Oh yeah, I'm sorry. Do you have any prescribed medications or any medications that you're taking over the counter or at any type of herbal medicine?
I don't have any prescription medications, and I don't do any herbal supplements. I do have women's multivitamin and calcium and vitamin D that I take.
Perfect. So I'll go ahead and make notes and give those to the provider. And then throughout this conversation, I see that you're alert and oriented. You are dressed for the weather, and you're cognitively intact because you are able to answer all my questions without any stuttering, or you're able to formulate sentences.
Okay. I did have one question. I haven't gotten my flu shot yet for this year. So is that something the doctor's gonna be able to do for me today?
Yes.
Okay.
We can provide you flu vaccine this year, and then as far as like any other immunization, do you know if you're up to date with your tetanus and your HPV vaccine?
I know I'm up to date on my vaccinations. I've not had the HPV, and I do have the tetanus. I just wanted to know about the flu shot today.
Okay, perfect. We'll go ahead and let the provider know so we can put an order in for you.
Excellent.
And then we're gonna move on to taking some vitals.
Okay.
Right. And for the blood pressure, I'll go ahead and do the two-step vitals. Okay. First one is just gonna get an idea of what your top number is, which is your systolic number, and then I'm just gonna palpate your radial pulse. Okay. Go ahead and do this on your arm for me. Perfect. Great. About 140. And then we'll go ahead and I'm just gonna let your arm rest for 5 minutes. I'll go ahead and take your pulses on both arms. Good. So your pulse is at 70, equal by line median plus 2. And then I'll go ahead and take your temperature. 98.4, and your respiration is 16, even and unlabored. Then I'll go ahead and take your blood pressure next. Sorry. Blood pressure is good. It's 122 over 70. Is that about normal for you for your baseline?
That's pretty good.
Okay. Do you have any questions so far?
No.
Okay. And then your ear pain.
Yes.
So your pain, remind me again, from 0 to 10, 0 being none and 10 being the worst.
It's about
It's still
still
at 5.
Yeah.
Okay, so we can probably give you something to start with to help with the pain, and then provider's probably going to prescribe something else after your visit with the provider, okay? And then, so next thing we're gonna do is just some assessments. We're gonna, start with your head and then move on down to your foot, okay? First thing I'm gonna do is just kind of assess your head and inspect your head for any type of abnormalities. All right, and then as I'm looking at you, it looks like your head is symmetric. And then is it okay if I touch you? Just sanitize my hands one more time. All right, so we're inspecting and palpating your head. I'm gonna palpate for any tenderness, any deformities. Are you having any pain?
No.
Any tenderness?
No.
Okay. And then while I'm at your head, I'm also looking at your hair, inspecting for any type of lice or any scales or dandruff. And I'm also looking at your hair color. It's not oily, and it is the color is appropriate for your ethnicity. And then you know, your head is normocephalic. There's no tenderness or any type of abnormalities, which is an expected finding. And then I'm going to move on to your face, if you don't mind taking your mask out for me. All right, so I'm also inspecting for your face. I'm going to go and inspect and palpate the area of your face. And then throughout this assessment, I'm also testing for cranial nerve 5 and cranial nerve 7. Okay, so I'll go ahead and I'm looking at your face. Your face is normal, symmetric. There's no unevenness, and that could be related to any type of thickening or acromegaly. And then I'm just gonna palpate your face for any lines and tenderness. So good. Skin is warm bilaterally, and then I'm gonna palpate your TMJ. Okay, that's okay. And then I'm gonna go ahead and say after me, and then clench your teeth for me, and then chew. So good. There's no popping, no jaw locking, no crevices on your jaw when you're did those movements. I'm also gonna ask you to close your eyes and let me know, this is for the sensory part, and let me know which part of your face you feel this hot and ball, okay?
Forehead, chin, left cheek, right cheek.
Good. And then for your facial, just cranial nerve 7, I'm gonna have you raise your eyebrows for me. Close your eyes really tight, open them really wide, smile for me, frown for me, and pop out your cheek. Good. So your cranial nerve 7 is intact. And then I'm going to move on to your eyes. I'm looking at your eyes. Your eyes are normal. There's no swelling or edema. There's no atropion or entropion of your eyelids. And there's no sty or any type of abnormalities. And then go ahead and lower your eyelids for me so I can check your the color of your conjunctiva is appropriate to your ethnicity. I'm also going to check for clarity of your cornea. I'm going to shine this light and just check for your clarity, okay? Clarity on your cornea, with no abnormalities or no redness. And then we're going to move on to cranial nerve 3 by using Perla. Perla means your pupils are equal, round, reactive to light, and they also accommodate when you look far, and your eyes accommodates when they dilate as you look far, and then they constrict essentially when you look close. Okay, so we're going to go ahead and do that. Good. All right. Good. Then you're just going to look at this bed with the high knee and my ear. Good. And then lift that. Good. That's good. You okay? So cranial nerve 3 is good and intact. And then next I'm going to do is just check for your extraocular movements, which is cranial nerve 3, 4, and 6, by using the 6 cardinal gazes. Okay. I'm gonna have you do, Kristen, this assessing for your eye muscles, all right? And then it's also assessing for any type of nystagmus of your eyes. Okay, so I'm gonna put this pen here, and you're just gonna follow it with your eyes without moving any other, without moving your neck. Okay. Extraocular movements, which is cranial number 3, 4, and 6, are good and intact. The next thing is we're going to move on to your ears. I'm going to inspect your ears and palpate them, and then let me know if you feel any type of tenderness or anything. Okay, there's no tenderness or swelling in the ear. There's no edema. Do you feel any pain? No. Okay. I'm just going to check for discharge as well. If you're having pain on your right ear, there's no sign of discharge in there. No sign of discharge in there. And then I'm also gonna check for cranial nerve 8. Okay, so I'm gonna let you hear. Check. Stand up. Stand up. And then both sides. Okay. Good. Hearing is equal and bilaterally. And then next I'm gonna do is just inspect your nose. All right, and then I'm gonna palpate your nose for any type of tenderness or any type of septal deviation. That's all. All right, so the next thing we do is just, do you have any tenderness or pain? No. There's no abnormalities or maybe look up there. I'm just gonna look up for me. All right, there's no any redness or swelling inside your hair, so that's good. And then go ahead and hold, put your pinky on your left and then breathe out for me. Okay. Feel on your side. Any pain? No, no pain. Okay. And then the next thing I'm gonna do is check for your throat. Move on to your throat as I'm looking at your mouth and your lips. It's moist and the color is appropriate for your ethnicity. And then I'm also going to inspect the inside your mouth. Okay. Good. Your buccal mucosa is intact, moist, and there's no sign. Say, I'm going to look at your tonsils. Go ahead and stick your tongue out. And your uvula is aligned. Your tonsil is good. There's no swelling. It's +2, 3 + 2, and there's no exudate or edema. Your buccal mucosa is warm, moist, and pink, and there's no dental caries or any missing teeth on your teeth. All right, and then I'm going to ask them. So the next thing I'm going to do is just ask you to say "ah" for me. All right, the reason I do that is to check your cranial nerve 10. There's no hoarseness. And then go ahead and swallow for me. All right, that checks for cranial nerve 9. And then go ahead and stick your tongue out and move it up and down, side to side. Good. That checks for cranial nerve 12. And then I'll go ahead and check for your accessory muscles, which is your cranial nerves 11. Okay. And then shrug your shoulders for me. And then breathe. Good. And then no. Okay, so I'm gonna go back to your face. I'm just gonna fill your sinuses, your frontal sinuses. All right, anything I can in there? Okay, all right, perfect. And then I'll go ahead and check for your lymph nodes. I'm gonna start behind the base of your skull, your occipital nodes, and then I'm gonna move on to your preauricular, postauricular, and then your tonsillar, your submandibular, and submental, And then I'm also gonna check for your cervical nodes and your post cervical nodes and your subclavicular nodes. Good. And then first thing, the next thing I'm gonna do is I'm going with your lymph nodes, I'm gonna go with your skin. Just gonna survey your skin and then check for any swelling, edema, any signs of dehydration, and I'm also going to check for any kind of normal lesion. Okay. Good. There's no swelling or edema. Your skin is warm, and your skin color is appropriate for your ethnicity. And then I'm going to check for your skin trigger for dehydration. Good. Your skin buds are back, which means you're not dehydrated. Also, we're going to check for your papillary refills. Papillary refills are good. That's like 3 seconds, and your nail bed looks good. Your nails are intact. Your nail bed, there's appearance in there. So those are good. Next thing I'm going to do is go ahead and while I'm down here, I'll go and check your patella reflex. Okay? Good. Good. Sorry. Any pain in there? No. All right. So I'm going to move on to your sensation. So that's rated a +2, right? And then I'm move on to your sensation. And then this is going to be the doll that you're going to feel. And this is going to be chart that you're going to feel. And this is the blood. Okay. Okay. And then I'm going to have you close your eyes. And then let me know what you feel, okay? Sharp on the left, dull on the right, sharp on the right, dull on the left, sharp on the left, sharp on the left, or right, sorry. Dull on the right, sharp on the left, sharp on the left, dull on the right, sharp on the left, dull on the right. Good. All right, and then I'm going to check for your accuracy as well. Okay. So you're going to go ahead and close your eyes, and then you're just going to bring your point finger on your nose. Okay? And then when you're ready, good, good, good. And then the rapid movement, you're just going to release on your finger. You go faster and faster. Good. Accuracy is good. And then I'll have you go ahead and at this point, I'll go ahead and have you stand up and press your gait movement. Okay, I'm going to have you walk towards there. You see plants in there, and then just towards back to you. Your gait is good. There's normal swaying in your arms. And then I'm just going to have you stand there real quick. I'm going to test for your balance, which is called the Romberg test. Okay. All right. And then I'm going to do this for about 3 seconds. I'm going to have you close your eyes for me. Romberg test is negative, which is normal. All right, next thing I'm going to do is just check for your spine and your posture and your back and your assess for any abnormal curvatures of your spine. And then for your back, is it okay if I lift your shoulder here? I'm going to assess for color, tenderness, and palpate for any tenderness. Okay, feel anything? Nope. Okay, good. There's no swelling, and the color of her back is appropriate for her ethnicity. And then your spine is good. There's no sign of any kyphosis, any lordosis, or any signs of any scoliosis. Okay. And then, Kristen, are you ready to do for some exercises? Sure. All right. So this is going to assess your range of motion and just the movement of the whole overall skeletal muscle. Okay. And then if at any point in time you feel anything, let me know if you're having any pain, okay? And then do you have any type of limited range of motion that I need to be aware of before I have you perform any of these exercises? Yeah. Okay, good. So we're going to start with your neck, all right? We're going to start with flexion, extension, lateral, side to side, and then rotation. Good. Your range of motion in your neck is good and intact. And then we're gonna move on to your shoulders. Okay. All right. We're gonna start with flexion, extension, abduction, adduction, internal rotation, external rotation, and then we're gonna do the opposite. Internal rotation, external rotation. And then we're gonna move on to your elbows. We're gonna do flexion, extension, and then your wrist. Oh, wait, hang on, supination, formation, supination, and then we're gonna do your wrist. Flexion, extension, and then your fingers for flexion, extension, adduction, adduction, and then finger cross, opposition. Good. All right, and then your upper extremity range of motion is good and intact. I'll go ahead and test for your strength for your bicep, triceps, and your arm grip. Okay, go ahead and push, pull, and then grip my fingers. All right, so your strength and grip is good and intact, and it's 5 out of 5. Okay, and then we're gonna move on to your lower extremities. We're gonna start from your hip, and then we're gonna start on your right hip by flexion, extension, abduction, and then internal rotation, external rotation. Good. We're gonna do the opposite. Your hip, flexion, extension, adduction, internal rotation, external rotation. We're gonna move on to your knee, flexion, extension, then flexion, extension, and then for your foot, eversion, 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 dorsiflexion, and plantar flexion, then dorsiflexion and plantar flexion. Then lower extremity range of motion is good and intact. When I have you have a seat, I'm going to test for your muscle strength on your quadriceps and your dorsiflexion and plantar flexion and your hamstring. All right, go ahead and push for me, and then pull down, and then push up for me, and then pull down. All right, so muscles on your quadriceps, hamstring, and your dorsiflexion and plantar flexion are 5 out of 5, which means they're normal. Do you have any questions, Kristen?
And you said by lower extremities, do they have a full range of motion?
Yes. Yeah, the full range of motion in the lower extremity with your quadriceps, hamstring, and your plantar flexion and your dorsiflexion.
I don't think I have any other questions.
Okay, and then I think this concludes the assessment. I'll go ahead and report with the provider. She's probably going to review your chart and then she'll be right in.
Okay, sounds good.
Thank you, Kristen, for letting me work today, for being so patient. I
Thank you,
appreciate it.
No, it was fun. Thank you.